Cardiologist warns 9-foot signs of hidden diabetes after 60. Stop what you're doing right now, even if just for a brief moment, and direct your gaze downwards towards your feet. What I'm about to unveil is not merely a collection of observations, but potentially the critical information that could mean the difference between detecting a silently progressing, potentially deadly disease in its nascent stages, when your body is still merely whispering hints, versus discovering it 5 years down the line when it has progressed to a deafening roar. Let me share with you the compelling story of a patient I'll refer to as Walter, a spirited 71-year-old retired plumber hailing from Ohio. He entered the doors of my office last spring for what was scheduled as a routine cardiology follow-up appointment. Walter presented with no alarming symptoms. He felt entirely fine, reporting no chest pain, no discernible shortness of breath, and his energy levels were quite decent for a man his age. It was right at the tail end of our consultation, almost an afterthought casually tossed into the conversation by his attentive wife, that she mentioned his feet had been experiencing a peculiar numbness for approximately the past year or so. Walter, with a dismissive chuckle, brushed it off, attributing it to the inevitable march of time, stating, "It's just age, Doc." However, something within me, a subtle intuition honed by years of medical practice, urged me to delve deeper, to probe beyond the surface. We proceeded to run one additional, specific blood test that very afternoon. The results, when they returned, were stark and unequivocal. His fasting glucose level registered an alarming 218 milligrams per deciliter, and his hemoglobin A1C, a crucial indicator of average blood sugar over several months, stood at a concerning 9.2%. It became chillingly clear that Walter had, unbeknownst to him, been a full-blown diabetic for a minimum of 2 years, and he had absolutely no idea because no one had ever taken the time to interpret the subtle, persistent messages his feet had been tirelessly attempting to convey. I am Dr. Marcus Acora, a dedicated heart surgeon, and for the past 2 decades, my professional life has revolved around operating on the intricate machinery of the human heart, meticulously observing the cumulative effects and devastating consequences that manifest in the bodies of seniors when seemingly minor health issues are overlooked or left unaddressed for far too long. Here, then, is a profound truth that is almost never adequately explained or properly understood by anyone outside the immediate sphere of medical practice. Diabetes is fundamentally not merely a sugar disease, as it is often simplistically portrayed. Rather, it is, at its core, a vascular disease, an insidious condition that systematically attacks and compromises the intricate network of your blood vessels. And critically, the blood vessels that most frequently succumb to this damage first are invariably those situated furthest from the heart, comprising the longest and most vulnerable delivery routes within your physiological system, namely your feet. Today, my intention is to meticulously guide you through 9 specific, often overlooked warning signs that distinctly manifest on your feet, long before any conventional blood test might definitively catch the underlying problem. Some of these signs I can almost guarantee you have probably been experiencing for months, perhaps even years, without recognizing their true significance. Others you may have consciously or unconsciously dismissed as simply an unavoidable part of the aging process. I urge you to remain with me through the comprehensive explanation of all 9 signs, because sign number 5, in particular, is the one that almost no one intuitively connects to diabetes, yet it holds immense diagnostic value. And sign number 9, while being the easiest to visually identify, presenting itself in plain view every single day, is paradoxically the most commonly overlooked and misunderstood. Let us embark on this crucial journey of understanding. The first critical sign is persistent tingling or numbness in your feet. It's important to differentiate this from common experiences. Almost everyone, at some point, has felt the familiar pins and needles sensation. Perhaps you've sat cross-legged for an extended period, causing your foot to fall asleep, only for the sensation to dissipate once you stand and restore circulation. That transient feeling is entirely normal and not a cause for alarm. What requires your focused attention, however, is whether this tingling or numbness is occurring regularly, seemingly without any clear, immediate reason. Are you experiencing it while sitting calmly at the breakfast table, lying still in bed, or simply taking a short walk to the mailbox? If your feet are tingling or feeling numb on their own inexplicable schedule, without an obvious external trigger, your nerves are unequivocally sending you a message, a silent communication that demands interpretation. When blood sugar levels remain excessively high for prolonged durations, the surplus glucose in your bloodstream begins to act much like a slow-acting acid, gradually eroding and dismantling the protective myelin coating that intricately wraps around your delicate nerve fibers. To fully grasp this concept, envision your nerves as essential electrical wires, similar to those found in household appliances. The plastic insulation encasing these wires is what ensures the electrical signal remains clean, strong, and uninterrupted. If you were to strip away that vital insulation, the wire would still technically function, but the electrical signals traversing it would become fuzzy, distorted, or significantly weakened. That precise fuzziness is the physiological manifestation of what you perceive as tingling or numbness. The American Diabetes Association, a leading authority on the disease, conservatively estimates that nearly half of all individuals diagnosed with diabetes will eventually develop this type of nerve damage, medically termed peripheral neuropathy, and it almost invariably commences in the feet, often silently advancing before any other overt symptoms appear. My earnest advice here is practical and accessible. Endeavor to take a consistent 20-minute walk every single day if your physical condition permits. This isn't about strenuous jogging or intense athletic activity. A gentle, purposeful walk is sufficient to stimulate circulation and nerve health. Furthermore, and perhaps most crucially, begin the immediate process of reducing your intake of added sugars in your diet. Do not defer this vital change to next month or next week. Initiate it today for the benefit of your long-term health. Moving to the second significant indicator, we observe a burning sensation in the soles of your feet, a symptom that often intensifies, particularly at night. This particular sign is notoriously sneaky and can easily be overlooked because it frequently doesn't manifest or bother you significantly during the bustling daytime hours when your mind is occupied and distracted by daily tasks. Instead, it tends to strike with an insidious persistence around 11 p.m. or later, when you've settled into bed, the room has grown quiet, and there is little else to focus on except the uncomfortable, persistent heat emanating from the bottoms of your feet. Patients describe this sensation in a myriad of ways, some likening it to the feeling of having walked barefoot across a scorching hot beach, others describing it as a slow, dull, unyielding burn that simply refuses to subside. When I, as a heart surgeon, hear this specific complaint articulated by a senior patient, my ears immediately prick up, signaling a heightened level of concern. This is because burning feet at night is unequivocally recognized as one of the textbook early signs of diabetic neuropathy, the very nerve damage we discussed earlier. The nerves in your feet, having been compromised and damaged by elevated blood sugar, are now misfiring, sending erroneous heat signals to your brain even when no actual hot object or external heat source is touching your skin. Consider it akin to a fire alarm system equipped with a faulty sensor. The building itself is not actually on fire, but the alarm is relentlessly screaming its warning because the sensor itself is malfunctioning and sending incorrect data. A comprehensive study published in the esteemed journal Diabetes Care provided compelling evidence that this burning pain often emerges a significant 1 to 3 years before a formal clinical diagnosis of diabetes is typically made. That's a profound window of opportunity, 1 to 3 years of advanced warning that your own body is diligently attempting to communicate to you. The remedial approach here is multifaceted but straightforward. Firstly, commit to drinking at least 8 glasses of plain water every day, ensuring your body remains adequately hydrated. Secondly, make a conscious effort to incorporate ample fiber into every single meal. Excellent sources include a diverse array of vegetables, wholesome oats, and various types of beans. Fiber plays a crucial role by slowing down the rate at which sugar is absorbed into your bloodstream, which in turn provides those damaged nerves a much-needed opportunity to recuperate and function more effectively. The third sign marks a dangerous progression where diabetes ceases to be merely uncomfortable and begins to become actively life-threatening. Cuts and small wounds that simply refuse to close or heal. It's a distressingly common scenario. Patients present at the emergency room, often recounting a story along these lines. "Doctor, I developed this small blister from my new shoes about 3 weeks ago. It's still open, and I just assumed it would heal on its own, as small cuts always do." And indeed, in a healthy, unimpaired body, a minor cut or blister should typically close and begin to heal within 5 to 7 days, demonstrating the body's natural regenerative capabilities. However, when blood sugar levels are consistently elevated over time, the incredibly tiny, delicate blood vessels in your feet begin to stiffen and narrow, impeding critical circulation. The essential white blood cells, oxygen, and vital nutrients, all indispensable components for effective wound closure and tissue repair, simply cannot reach the affected area in sufficient quantities or with adequate speed. Visualize attempting to water a garden using a garden hose that has a severe kink in it. The water supply is undeniably present, but it's simply not reaching the parched soil where it's desperately needed. Here is a chilling and sobering statistic from the Centers for Disease Control and Prevention, CDC. Diabetic foot ulcers are unequivocally the leading cause of non-traumatic leg amputations in the United States, accounting for over 100,000 such procedures every single year. And almost without exception, every single one of those tragic amputations began as a small, seemingly innocuous wound that was unfortunately ignored or inadequately treated. Tonight, after you've completed your shower, take a few extra minutes to sit down in a well-lit area and meticulously inspect both of your feet. Pay particular attention to the spaces between your toes and the often overlooked skin underneath your heels. If you discover any cut, blister, or open spot, no matter how small, gently cleanse it with mild soap and water. Apply a basic antibiotic ointment to prevent infection, and cover it securely with a sterile dressing. And crucially, if that wound shows no signs of improvement or begins to worsen within 48 hours, do not hesitate. Call your doctor immediately. Do not postpone it until next week. 48 hours is the critical window for action. The fourth indicator, often hiding in plain sight, is the darkening or discoloration of the skin on your lower legs and feet. This is a subtle change that many people unconsciously dismiss. You might catch a glimpse of your ankles in the shower and notice they appear a little darker, perhaps with a reddish hue, almost bruised in appearance, even when you are certain you haven't bumped or injured anything, and your internal monologue might rationalize it, telling yourself, "I've always had slightly darker skin around my ankles," or "it's just part of getting older." While individual skin tones certainly vary, there is a very specific pattern of discoloration that medical professionals are specifically trained to identify, and it has a distinct name: diabetic dermopathy. When the small, fragile blood vessels in your lower legs are subjected to sustained damage from chronically high blood sugar levels, the skin in that particular area simply doesn't receive enough fresh oxygen and vital nutrients. Over an extended period, this lack of adequate perfusion causes the skin to gradually change color. You might observe a general darkening, a persistent reddish stain, or even distinct patches that take on a slightly bluish tint, indicative of poor oxygenation. Furthermore, the affected skin may also become noticeably thinner, more fragile, and consequently much more susceptible to bruising or tearing. A significant study published in the Journal of the American Academy of Dermatology revealed that these characteristic skin changes are typically detectable, on average, a remarkable 18 months before a formal diagnosis of diabetes is officially made. That represents a year and a half of crucial warning signs literally written on your skin, providing an invaluable opportunity for early intervention. My strong recommendation here is simple yet effective. Dedicate just 5 minutes each morning before you even place your feet on the floor to performing ankle circles, gentle toe raises, and light calf stretches. Even this seemingly small amount of consistent movement plays a significant role in helping to actively push fresh, oxygenated blood into your lower legs, improving circulation and reducing the likelihood of such skin changes. Before we delve further into the remaining crucial signs, let me pause and sincerely ask you a direct question. Have you, or perhaps a beloved family member or friend, noticed even one of these first four signs manifesting in your own body or theirs? If your honest answer is yes, I implore you to type the word yes into the comments section below. Just the word yes. I personally make it a point to read every single comment posted on this channel, and it is incredibly valuable for me to understand what you, the audience, are observing and experiencing in your own bodies. And while you're there, please take a moment to hit the like button. This simple action signals to YouTube that this video contains important, relevant information, and it will, in turn, help ensure that it reaches a broader audience of seniors who genuinely need to see and comprehend this vital message. Now, let's proceed to the fifth sign: heels that crack and split open persistently, defying all attempts to heal, no matter how much lotion or moisturizing product you apply. This particular sign is the one that most frequently catches my patients by surprise, often prompting a moment of realization. I fully acknowledge that cracked heels are a common complaint among older adults, often attributed to general wear and tear or environmental factors. However, there's a distinct difference when your heels are cracking deeply and painfully in the middle of July, a time when skin is typically more hydrated, and when no amount of lotion, regardless of its quality or frequency of application, seems to make any lasting difference. That, my friends, tells a completely different and far more concerning story. Diabetes has a unique and insidious way of attacking a specialized group of nerves known as the autonomic nerves. These are the unsung heroes of your nervous system, responsible for controlling all the automatic, involuntary functions that your body performs seamlessly, without your conscious thought, including the crucial operation of the sweat glands in your feet. These glands are vital because they are designed to naturally keep the skin of your feet moisturized from the inside out, maintaining its pliability and integrity. When these essential autonomic nerves become damaged by persistently high blood sugar levels, it's as if the internal moisture pump supplying your feet simply shuts down. Consequently, no amount of external lotion, however potent, can effectively address the root cause of this profound dryness. And crucially, these deep cracks in the skin of your feet are not merely a superficial cosmetic problem. They represent dangerous open doorways for bacteria to infiltrate, paving the way for serious infections. In a foot already compromised by poor circulation, a bacterial infection can escalate from a minor issue to a severe limb-threatening crisis in a matter of days, not weeks. The American Podiatric Medical Association, a highly respected authority in foot health, has specifically identified chronic treatment-resistant heel cracking as a meaningful and clinically significant indicator of autonomic neuropathy in senior populations. My recommendation for this: every night before retiring to bed, make it a dedicated ritual to thoroughly moisturize your feet. Coconut oil, with its natural emollient properties, works beautifully, but any good quality, thick moisturizing lotion or cream will suffice. Apply it generously to the soles and heels, but with one crucial caveat: never apply moisturizer between your toes. Trapped moisture in this interdigital space can inadvertently create a warm, damp environment that actively invites fungal growth. And, as a consistent thread throughout this discussion, continue to drink your water diligently. Your skin requires optimal hydration from the inside, just as much as it benefits from external moisturization. Sign number 6 is persistent swelling in your feet and ankles, a condition known as edema. Some degree of swelling in the lower extremities is, of course, normal and expected in certain circumstances. For instance, if you've spent an entire day on your feet, perhaps attending a long wedding or endured a protracted international flight, it's entirely common for your ankles to puff up a bit. This type of transient swelling typically resolves completely overnight with rest and elevation. What I am referring to, however, is a distinctly different and more concerning pattern. Swelling that is present almost every single evening. Swelling that leaves deep, lasting indentations from your socks, often referred to as sock marks. And crucially, swelling that does not entirely subside or go down by morning. This persistent edema is often a critical alarm bell when high blood sugar damages the kidneys, and it's a sobering fact that diabetes stands as the leading cause of kidney disease in this country. Your body's intricate fluid regulation mechanisms become severely disrupted and thrown off balance. Excess fluid, responding to the relentless pull of gravity, pools downwards and consequently settles in the lowest parts of your body, your ankles and your feet. To assess this yourself, try a simple test. Press your finger firmly into a swollen ankle, hold it there for approximately 5 seconds, and then release. If the indentation created by your finger lingers there for several seconds before gradually bouncing back, that phenomenon is medically termed pitting edema, and it is a very real, clinically significant medical sign that absolutely warrants immediate attention from your doctor. The National Kidney Foundation reports that diabetic kidney disease impacts roughly 1 in 3 adults living with diabetes, and persistent lower leg swelling is very often the earliest visible signal that kidney function is beginning to falter or slip. The advice to mitigate this is straightforward. Elevate your feet for about 15 minutes a few times throughout the day, paying particular attention to this in the evening. Even elevating them just a few inches on a pillow or footrest is sufficient to assist in draining excess fluid back towards your heart. Furthermore, become acutely aware of the sodium labels on the foods you consume. Salt is a powerful water-retaining agent in your body, and the unfortunate reality is that most processed foods are excessively loaded with it, contributing significantly to fluid retention and swelling. The 7th warning sign manifests as sharp, stabbing, or electric shock-like pain in your feet, a symptom that is particularly prevalent at night. This is, without a doubt, the sign I personally encounter being misdiagnosed more frequently than any other. Men, in particular, often present in my office recounting stories such as, "Doc, I've been taking ibuprofen for persistent foot pain for the past 6 months, assuming it was just arthritis acting up or perhaps an old injury resurfacing." And sometimes their self-diagnosis is indeed accurate. The pain can genuinely stem from arthritis or a previous injury. However, there are numerous instances where the pain has absolutely nothing whatsoever to do with arthritis. When the delicate nerves in your feet are damaged by chronically high blood sugar, they don't always simply go quiet or cease to function. Quite often, they react in the exact opposite manner. They become hyperactive, exquisitely sensitive, and begin firing random, intense pain signals into your brain, even when there is no actual physical injury or discernible problem in the foot itself. Patients vividly describe this as a sudden, unexpected stab, the sensation of a hot needle piercing their flesh, or an abrupt electric shock that seemingly comes out of nowhere. This type of neuropathic pain is most pronounced at night, especially when you are lying still in bed with no distractions. While ibuprofen and other over-the-counter pain medications might temporarily mask this pain for a few hours, providing fleeting relief, they fundamentally do not address or repair the underlying damaged nerves. Worse still, consistently taking ibuprofen daily over the long term carries its own spectrum of significant dangers. It is known to raise your blood pressure, it can cause damage to your kidneys, and as a heart surgeon, I can tell you plainly and unequivocally that it actively increases your risk of experiencing a heart attack. A pivotal study published in the prestigious New England Journal of Medicine illuminated that this specific kind of painful diabetic neuropathy affects approximately a quarter of all individuals living with diabetes and is, regrettably, frequently mistaken for arthritis for years before anyone thinks to test blood sugar levels. My recommendation to help alleviate this: every morning before you even attempt to stand up and bear weight on your feet, dedicate 5 minutes to performing gentle foot stretches while still in bed. Flex your feet up and down, making controlled movements. Circle your ankles slowly in both directions. Gently pull your toes back towards your shins. The objective here is to get circulation actively moving and Invigorate those nerves before the full weight of your body is placed upon your feet. Sign number 8 reveals itself as persistently cold feet that remain cold no matter what external conditions or warming attempts are made. We all, of course, experience cold feet occasionally. Cold floors in the house, frigid winter weather, that's simply a part of life. However, what demands your attention is a distinctly different scenario. Whether your feet are cold in the middle of a warm July summer, cold even when tucked under 3 thick blankets, or cold while the rest of your body feels comfortably warm, that specific pattern entirely changes the diagnostic picture. As a heart surgeon, this is the sign that instantly illuminates my brain like a bright flare, triggering a high level of concern. Because persistently, cold feet that stubbornly refuse to warm up are one of the clearest and most unequivocal signs of peripheral artery disease, PAD. This is a serious condition where your blood vessels, particularly those supplying the extremities, have become narrowed and hardened, often as a direct consequence of long-term, uncontrolled high blood sugar. Consequently, warm, oxygenated blood simply isn't reaching the very ends of your feet in sufficient volume or pressure. To better understand this, picture your body's circulatory system akin to a heating system in a large, sprawling house. When the pipes within that system become narrowed or obstructed, the radiator located in the furthest back bedroom will inevitably remain cold, no matter how vigorously the furnace attempts to work and pump heat. The American Heart Association estimates that a staggering more than 8 million Americans are currently living with peripheral artery disease, and critically, diabetes stands as the single largest and most potent risk factor for its development. Cold, often pale feet are therefore one of its earliest and most telling signs. The single most effective action you can take to address this, and indeed improve overall vascular health, is to commit to a brisk 30-minute walk every day. This is not a leisurely stroll, it's a purposeful walk with arms swinging and an elevated pace, designed to truly challenge your cardiovascular system. If 30 minutes initially feels like too much, begin with a manageable 10 minutes and gradually increase the duration. The fundamental goal is to actively force your blood to push into your lower legs, strengthening the walls of your blood vessels, and over time, even partially reversing some of the early narrowing that has occurred. Finally, we arrive at sign number 9. This is the one that almost nobody talks about, the quietest yet often most profound indicator. In my entire career, I have never once heard a patient spontaneously bring this particular sign up themselves during a consultation. It is exclusively when I am conducting a thorough physical examination of their lower legs that I notice it. And upon bringing it to their attention, they often look down in surprise and exclaim, "Huh? I never noticed that before." Take a moment, therefore, to carefully examine the skin on your lower legs and the tops of your feet. Then, compare the amount and thickness of hair present in these areas to the hair on your thighs. Is the hair on your lower legs significantly thinner, noticeably sparser, or perhaps even completely gone in certain patches? Hair follicles, though tiny biological structures, are incredibly demanding. They require a consistent, robust supply of fresh blood and oxygen to sustain their growth and health. When the circulation to your lower legs has been compromised and diminished by years of persistently high blood sugar, the hair follicles in that area slowly but surely stop receiving the vital nourishment they need, and consequently, the hair growth ceases. The absence of hair on your lower legs is, therefore, a quiet yet profoundly visible marker of blood vessel damage that has been silently accumulating underneath the skin for years, perhaps even decades, preceding any overt symptoms. Published research in the esteemed journal Diabetes, Obesity, and Metabolism has definitively confirmed that hair loss on the lower extremities correlates strongly and reliably with peripheral vascular disease in individuals with diabetes. It is, in essence, a reliable physical sign that that vascular doctors are specifically trained to check for as part of their diagnostic protocol. Immediately after you finish watching this video, take a moment to look down at your lower legs and feet with a critical, informed eye. If you observe that the hair in these areas is significantly thinner or entirely absent, I implore you to schedule a simple fasting glucose blood test this week. Do not procrastinate until next month. Prioritize it this week. This vital test, which can be performed at any standard lab, typically costs approximately $12 and, for most individuals, is covered by Medicare. A mere $12 and a single blood draw possess the profound potential to alter the entire trajectory of your health, shifting it from a path of silent progression to one of informed management and control. So, let me now bring all of these crucial observations and insights together into a cohesive understanding. Your feet, those hardworking foundations of your body, are constantly communicating with you, offering 9 distinct warning signs: persistent tingling and numbness, a burning sensation particularly at night, small cuts and wounds that stubbornly refuse to heal, darkening or discoloration of the skin on your lower legs, heels that crack and split open despite all moisturizing efforts, persistent swelling in your feet and ankles, sharp stabbing or electric shock-like pain often at night, feet that feel perpetually cold irrespective of external temperatures, and finally, noticeable hair loss on your lower legs. Each and every one of these signs is your body's incredibly intelligent early warning system, subtly yet persistently asking for help, often signaling a problem years before any standard blood test would definitively catch the issue. Here's what I want you to commit to doing tonight. Just one single, simple, yet immensely important thing. Sit down somewhere in your home where there is ample, good lighting, remove your socks, and take a dedicated 30 seconds to meticulously examine both of your feet. Look closely between your toes, inspect your heels, gently run a fingertip along the skin to check for any areas of numbness. Pay careful attention to the color of your ankles and lower legs. If, upon this examination, you see or feel even one of the 9 signs we have just thoroughly covered, please do not delay. Call your doctor tomorrow morning and specifically request a fasting glucose and a hemoglobin A1C blood test. The earlier this underlying condition is identified and caught, the more completely and effectively it can typically be managed, in most cases, with carefully implemented changes in diet, consistent daily movement, and a real open conversation with your trusted medical professional. You have undoubtedly worked far too hard throughout your life to attain the independence, vitality, energy, and the cherished ability to do what you love. Do not allow a fundamentally manageable condition like blood sugar imbalance to silently erode and take any of that from you, simply because nobody took the time to inform you what critical signs to look for. Now, if this comprehensive video has proven helpful or enlightening to you, I would greatly appreciate it if you could do 2 things for me. First, please share it on Facebook right now and tag at least one person you deeply care about who is over the age of 50. Perhaps a spouse, a sibling, a cherished neighbor, or a close friend. You might inadvertently be providing them with a piece of information they desperately need but are currently unaware they require. And second, please consider subscribing to this channel. As a heart surgeon, my commitment is to post a new video every single week, offering the kind of honest, evidence-based health information and practical insights that I share directly with my own patients. Knowledge that most people regrettably never hear outside the confines of a doctor's office. Subscribe and bring someone you love along for this vital health journey. It is crucial to remember that everything I have shared today constitutes general health education, meticulously based on published medical research. It is emphatically not a replacement for personalized medical advice tailored to your unique situation. Every individual's health circumstances are different and complex. Therefore, please always engage in a thorough discussion with your own physician before making any significant changes to your diet, your medications, or your established daily routine. I am Dr. Marcus Akora. Take exceptional care of those feet. They carry you through life. I will genuinely look forward to seeing you in the next video.